So, as you have seen in the previous short clip, there was a newborn who was brought by his mother with protruding mass from the lower back, from the sacrum region, and it was what could it be? Firstly, if you can guess the diagnosis, just write it down in the comment box after pausing my video. So the diagnosis is SACROCOCCYGEAL teratoma. Those who have guessed it right, congratulations to them. And those who have not, this video is for all of you. It's a informative video. So SACROCOCCYGEAL teratoma is a diagnosis. Now let us firstly understand what the teratomas are. Teratomas, they are benign tumors, and they contain basically the elements which are derived from the more than three embryonic germ layers, that is endoderm, mesoderm, and ectoderm, and they are more commonly in females. Teratomas are basically found in the midline. They could be found in the mediastinum, in the retroperitoneum, in the extragonadal regions, and the gonadal locations. And the extragonadal teratomas, they are mostly found in the neonates and young children, whereas the gonadal teratomas, they're mostly found in the adolescents. Now, this is a type of teratoma, that is sacrococcygeal teratomas, depending upon its location. Because it arises from the sacrum and the coccyx, that is why it is known as sacrococcygeal. Sacrococcygeal teratomas comprises 60% of all teratomas. And now, how you diagnose it? This is all about your teratomas and sacrococcygeal teratomas. Now let us discuss how to diagnose this case, sacrococcygeal teratoma. It can be diagnosed on the prenatally also and the postnatally also. On the prenatal, you can diagnose it through the ultrasound, prenatal ultrasound, when there's where you can see there is a polyhedrum nose, and there is a large exophytic mass which can be diagnosed in the prenatal phases. But if unfortunately, like in the starting of my video, I have presented the case of a newborn in which the child has been brought postnatally with the large exophytic growth present on the sacrum and coccygeal region. In that case, you can diagnose it clinically. Clinically, you can diagnose, but to detect the intra-abdominal and pelvic extensions, you can take the help of ultrasound, CT, and MRI also. Now, the management of the sacrococcygeal teratoma. As you have diagnosed the case that it is a sacrococcygeal teratoma, now how will you treat it? The surgical resection is the only treatment, because the tumor can undergo the rupture and there could be chances of tumor hemorrhage also. The tumor resection, basically the approach for the tumor resection, surgical resection, depends upon the Altman classification of the sacrococcygeal teratomas. Altman classification is basically tells you which approach to use. Like, you have to use perineal approach or the abdominoperineal approach. So, according to the Altman classification, there are 4 types of sacrococcygeal teratomas. In type 1, it is totally exophytic. There is no intra-abdominal extension. In type 2, there is a little bit of intra-abdominal extension also present along with the exophytic mass. In type 3, there is both 50-50, 50% exophytic, and there is a more intra-abdominal extension. And whereas in type 4, there is a whole tumor is present intra-abdominally in the pelvic location, and there is no exophytic growth present. So in type 1, where the tumor is totally exophytic, so the approach will be your posterior approach. You can take for surgical resection. That will be easy, and whole tumor can be resected easily. But when the in type 2 and type 3, where the intra-abdominal extension is also there, you can approach through the perineal and the abdominoperineal approaches. As in type 4, you have to take only the abdominal approach. There is no fun of taking or resecting the tumor through perineal approach, as there is no exophytic growth present. It is totally intra-abdominal. That is why. As we have discussed, the management of the tumors is only surgical resection. So surgical resection, what it contains? It contains basically the resection of the whole tumor along with coccyx. So you have to remove the coccyx also. And now the follow-up of this patient. How do you follow up this patient? You have to get the patient AFP, that is alpha fetoprotein, done on the follow-up every 3 months. Okay guys, that's it for today, and see you in the next video with another case scenario. Till then, subscribe to my channel, and also please like the video. Thank you so much.